every month. So, Madam Speaker, as I congratulate Madam Kadhonwa Mushomba, let's also remind ourselves, as a society, we have failed. Many people rarely go to take care of their parents. Many people rarely go to the rural areas. Once we vacate the rural areas, many of us rarely go back. I challenge the Kenyan society today that we need to make it compulsory. Every person must take care of his or her parent. And I think, Wamshomba, you need to look at that. That you cannot leave your father and mother. You have a
ensuring that there is absolutely no conflict of interest by public officers. And public officers, I want to agree with the Honorable Tiende Amolo in that respect, that a public officer does not necessarily mean an elective office or people holding elective offices. It is not just members of parliament and members of county assemblies. We have governors, we have the executive, right from the president to the ministers and the principal secretaries who are in appointive offices. All those, Honorable Speaker, we must hold them to account using this bill and ensure that even as we seek to self-preserve, we also enact laws that will hold everybody, even members of parliament, Honorable Speaker, and members of county assemblies, and even governors and presidents and deputy presidents who are elective, to account, and to ensure that there is absolutely no conflict of interest in the way they conduct public office, and there is a clear demarcation between your public affairs and your private business interests. Because, Honorable Speaker, if we are left in a situation where there is a blood distinction between what is private and what is public, Honorable Speaker, the era that we have been speaking of state capture will never come to an end. This is the opportunity we have as a house, and the country and history will judge us based on what we do with this bill. If we speak so much about the fight against corruption, and every time there is mention of a scandal here and there, the political class are usually the first to speak against corruption. Let us not just speak about against corruption and speak about corruption. Let us act. Let us enact laws that will ensure that there is no corruption, there is no conflict of interest, and in line with what we provided for when we elected to have this constitution as the supreme law of our country, that we actualize the provisions of Article 6, and specifically that 75, 1A and B that I have read. With that, Honorable Speaker, I do want to submit, Honorable Speaker, that we hold our horses as we await the JLA committee to table the addendum, and we be able to see what is it that they have proposed for amendments. And that is not to say, Honorable Speaker, that what JLAC will have proposed as amendments, if they do not carry an amendment that I intend to move, nothing, Honorable Speaker, stops any member of this House from moving an amendment to rectify what they think should be rectified in the bill. And if it makes sense, Honorable Speaker, without diluting the objectives of the bill, we shall support. But we must also do so in a cautious manner. With that, Honorable Speaker, I beg that we allow the JLA committee to finish their work and appraise the House accordingly. Thank you, Honorable Speaker.
Ocheng. Yes, I'll come to you. I've given to David Ocheng.
No, thank you so much, Mr. Speaker. Mr. Speaker, I also want to add my voice on this particular matter, and I agree with Honorable Tiende that there are issues that
give to David Ocheng the mic.
There are issues you need to address going forward, Mr. Speaker. I was so worried when I saw the bill in the draft order paper this morning, and I want to thank you and thank the House Bills Committee for seeing the sense in putting the bill.
What's happening to the mic?
But, Mr. Speaker, the biggest issue...
Order, honorable members, I want to hear Order.
Mr. Speaker, the biggest issue.
Order, Irene Kasalo and your team.
Mr. Speaker, the reason I believe this bill.
Order. I'm being called upon to make a ruling on a bill before you. Give me an opportunity to hear.
Mr. Speaker, the reason I believe this bill is very urgent is that sometimes we think about things in a very pedantic way, Mr. Speaker. Mr. Speaker, this country today is in this place it's in because we have allowed every government official to do business at every corner. And like I said last week, Mr. Speaker, the reason we're even having issues of liquidity is that we are allowing everybody, including members of parliament, to do business, but because
present. Thank you very much.
The Honorable Gideon Ochanda, member for Bondo.
Thanks a lot, Madam Speaker. Madam Speaker, if nature is good to your members, then all of us are basically talking about the subject matter on us. All of us are going to get to this stage if you're not yet there already. We are really the subject matter here. Madam Speaker, what we have had in this country or in many other third world countries is the little care that is placed on issues of social security, whether it is health, whether it is issues of pensions, whether there are issues of gratuities. I think there's been a major problem that we've had, more so as Kenya. At the moment, you can categorize elders in very many ways. There are those who are old because of age and they have not been in any skilled service. There are those who have been in skilled service. There are those who have been really professionals in terms of what they have been doing before. But on retirement, they are either looked at the same, yet many retire, but they are never tired. You look at the kind of a problem we have, particularly in education now with the teachers. I know parents are paying for close to half of what TSC is paying in the name of BOM teachers or board teachers. Yet, each year, there are very many people, many professional teachers who retire at 60. And then you realize that between 60 and 70, many of them still have the energy to engage. And that happens also even with other different professionals, including those who are in the disciplined services. We have clear arrangements like in the veteran organization, veteran programs, that really give space for those who retire to engage differently. And you know, once you retire and retire to nothing, chances of you dying much more faster are higher than when somebody retires and retires to some engagement. Retiring to something that still engages you, retiring to say that you appear like you have not retired, your life gets a little bit enhanced. Yet we are in a situation now where elders are operating or surviving in all manner of odds. The returns in terms of what they are doing has been reducing. Cultures are changed. Many communities are no longer placing elders where they were before. Pensioners, their money gets down with age. The more older you become, the more your pension reduces. So if you look at all these things, there are all manner of odds against the elders. And some very clear-cut program must be placed in front of them. In this country, we are talking about a life expectancy, if I checked last, was 62 years or 60, the life expectancy. That means that the group that we are talking about, their numbers have been reducing over a period of time. And if we check properly, it is a number that cannot help, the government can fail to support. The number has been reducing over a period of time. And if you put them in the categories that I was talking about, those that were professionals, and you still link them with their professional career, link them around what they were doing, in as much as you can give them some little support here and there, but they are linked such that they are busy, they are engaged. Those that are with skills, can they guide some different groupings? Can you have these village polytechnics, for example, encourage all manner of elders who had skills to be around the schools, be around the institutions? Then we'll end up with a small group, a small number of those who are retired or those who are getting old minus any skills, those who are depending basically on their labor. And I think it's easy. The government can plan this and it can be done. And it can be done virtually in every location if there are programs, if there was a clear will to do it. These people can be in homes, these people can be in their own homes, but there's an arrangement where they can eat, they can be serviced health-wise, they can get different... what I learned the other day that brings most of these elders down is basically food, water, because some of them can't wash their clothes, and then the disease, small little diseases bring them down. So, Madam Speaker, I think with a clear programmatic approach, we are able as a country and as a government to take care of our elders beyond what we are doing at the moment. 2,000 with the kind of life situation that we are in is not enough. And even if it were enough, the way it is disbursed is so absurd. And the kind of a data that we've been picking for the last 3 or so months, I think there's a problem sometimes in this country. Just counting how many are 60 plus and above is a challenge. The other time we have failed, in fact we have failed more than 10 years now, just to identify indigents that were supposed to be supported under universal health cover. But I think there's a big problem in this country, Madam Speaker, that needs to be sorted out. I support.
Thank you. The Honorable Moses Kirima, member for Central Imenti.
Thank you, Madam Speaker, for giving me this opportunity to contribute to this important bill brought by my colleague Azimio Mps. Madam Speaker, this bill is timely, taking into account that the population in Kenya, especially the aging group, is increasing in number due to improved medical facilities and improved dietary values which Kenyans are accommodating these days. It's their time that we should think of how to take care of the aged ones, taking into account that each and everybody plays to reach her old age. In developed countries, aged people are valued so much in a way that when the government is making policies, it usually consider them and give them value for what they had contributed during their early days, up to and including giving them mentors, recognizing them as veterans, and all kind of adulations to at least recognize their previous contributions to the welfare of the society. And that's why in Kenya, as we speak, the aged are not given priority so much, because at no time when you find that the government is having a policy of the aged, at no time when you find that the aged are given value of any kind other than the stipend of only 2,000 shillings per month, of which also rarely reach all of them. I do remember, like my mother, who died at the age of 89. She had registered for this stipend of 2,000 shillings, but she never received it until she went to the grave. I'm not alone, I'm just giving us an example in the village. There are many who do not even get that 2,000 shillings. Many intermediaries and many brokers in between the government and the banks where this money is channeled through get in between, and the money never reach the right people, but a certain percentage get it. So, Madam Speaker, my contribution is that the government should take or should be serious when addressing aged people issues, to the effect that if you go around the country now, you find many organizations, particularly individuals, coming out with old, aged people homes to take care of them. For the society has changed. It's not like the ordinary African society we used to have, whereby the youth or the young ones were taken care of by the aged with the hope of reciprocating the same at a particular time of age, whereby the young ones used to feed, light the fire, take care of the aged, but things have changed. These days, if the youth have a chance, they even dispose the properties of the aged ones, and they leave the aged ones in desperate and in destitute. So this bill is timely, and it's my prayer that when it comes to addressing the issues, as it comes to implementing this bill, we should consider the homes which are being established. Where do these aged ones go at a particular time when they are unable or when they have nobody to take care of them at their homes, when they cannot be able to feed themselves, when they are abandoned by their siblings in the rural areas and the siblings are moved to the urban areas. With those few remarks, I hereby support the same bill. Thank you, Madam Speaker.
Thank you. The Honorable Shakil Shabil. And it is important to note that your card has not been working.
Yes.
Honorable members, also the card for the Honorable Kengamupe. I have seen you there since we started and your card is not indicating anywhere. So I'll be giving you a chance at some point, Honorable Kengamupe.
Thank you, Madam Speaker, for indulging. As you said, some of these cards are not working. We sit here in the hope that they are recording, but they're not. And I hope that the Sergeant at Arms and those who are looking after this august house will have these machines serviced. Madam Speaker, I speak from a position of knowledge. In my earlier days, and even now, we set up a home for the elderly in England. That home had worked for something like 30 years. My family worked very hard, and even my sister-in-law was even awarded by the Queen for the work she did for the care of the elderly. So elderly in our family is in our genes. In our culture, the African culture, the Kenyan culture, even mine, whether the Luo culture, not only do we are meant to respect the elderly, but we also respect the spirits of our ancestors, which is even going further. The elderly are very much part and parcel of our society. And I don't understand what is happening to Kenya, what is happening to our people, where we are now ignoring and throwing our elderly away. There are cases in Kisii where people, the elderly, are being burnt as witches just because the children want to take over the properties. It is a sad state of affairs, and it tells us the society that we are in is degrading very fast. And the children and the elderly are the two pillars of our society, of our family. If our family values and our family culture cannot be supported, we are going to the dogs. We are going, and I think, as we say, the end of the world is close, because if we don't do this, and we cannot respect our elderly, we cannot respect our children, what are we doing? 90% of the workers here, nurses of this country, are in the UK, in the USA, in Japan, in wherever. I saw a big advert the other day. We are giving special visas for carers. Our people are going to care for some foreigners for money, yet they're leaving their own elderly behind. They're leaving their own elders behind. I think that we have Kenya as a culture. As much as I support, I did agree, may not have supported the housing levy. If there was something called an elder's levy, I would very much be part and parcel of that thing. I would want to contribute a certain percentage of my money to that. I firstly don't agree with the title, and I'm putting my amendment there, Geriatric Bill. And as much as my honorable Member of Parliament who has put that name there, I think that takes away the dignity of the elderly. I don't know why geriatric care. Geriatric care is a medical term, and I think we need to give this a more human touch. The National Council for the Care for the Elderly is again a good idea, but the social services are there. There is a directorate. I don't see why we need another national council. Everybody will come. The CEO will want a four-wheel drive. They will need this. They will need that. This will take up a lot of money. I think there's a directorate for the elderly which we can form very much within there and allow the directorate to hold. The directorate for the we also need some sort of format or rules of what elderly care requires. Whether there is care home for the elderly, the residential care home, the daycare centers, the community health. Madam Chair, Madam Speaker, when we ignore our children and don't send them to primary school, we commit an offense. I would suggest that we look at an offense, that if we do not take care of our parents, we would be committing an offense. The stipend of 2,000 is a joke. In my constituency, over 200,000 people, there are less than maybe 100, 120 get this 2,000 when they get it. Sometimes it takes 6 months. And then those are also stolen by other conmen and other people who come, even their grandchildren, who take the money away. The abuse of the elderly has been there. We have taken no action right now on that home that took place the other day where they've been beating up the elderly. And I think this is very important, that not only this, but we must have a framework so that we can put what is called effective action. Madam Speaker, the President of Rwanda about 10 years ago taught me this, that this is very good to have vision, but vision without implementation is hallucination. We hope that this geriatric bill, or what we hope to change the name, will be able to put in force immediately. It is passed, some structure, some format, some template, so that we can have we have the directorate, or what do you call it, the National Council, whatever we call it, to help the aged. These aged are quality people. I have some people who are professors. Professor Bethel Ogot, for one. He's nearly 95 years old, but he has got the brains better than me. I myself, Madam Chair, I'm 70 years old, so you'll call me an elderly soon. Where will I go? Is an elderly home for old parliamentarians? I don't know whether, I know there isn't. But what do we do with our old parliamentarians? I've seen some of them who have been leaders sitting at home, rotting and doing nothing. Even the pension that they get is peanuts. So I think what we need to do, the elderly must be cared for as a priority. The children must be cared for as a priority. Long gone are the times where I think in Europe now, people take care of their cats, people take care of their dogs more than they take care of their own family. Because we go from here at a cost to go and take care of the elderly, clean them up. They are not all elderly, are not senile. The all elderly are not dementia. The situation is, even if they are senile, even if they are dementia, and even if they are looking like mad, they were here. They have a right to this country, more right than the young, and more right that they have been there in the fight for this independence of this country. I hardly see an elderly person being given any recognition. I mean, Didier Kimathi, for one, the old who passed away, his own wife was not treated well. And there are so many who are not treated well. The elderly must be given recognition by the state, recognition by the county governments, recognition by the authorities. I was in Germany and I wanted to get on a train, and I was buying the ticket and I was told, no, you are elderly, over 65, you don't need a ticket. I still wanted to buy. I went to an orchestra and I wanted to pay. They said, no, yours is half price. What happens here in this country is they charge you even more. If you're on a matatu and you're an elderly, they charge you even more. So I think I do recommend, I support very much this bill. I do urge my members of parliament, let us look at this, let us strengthen it, let us give it, let it give it the bite that it requires, and let's look after the elderly the way they looked after us in our youth. Madam Speaker, thank you very much for indulgence, and thank the House, and I thank the sponsor of the bill. Asante sana, thank you.
Thank you very much. Honorable members, you may choose to speak for 5 minutes. I'm saying you may because we did not limit time at the beginning of the motion, so that a few more of you can speak, because I'm just looking at the screen and many people have expressed interest. We will now go to the Honorable Andrew Okome, member for Karachonyo. And I'm informed that you are the most senior in terms of age. Yes. So you may have something to say about this. Move to the next mic.
Madam Speaker, thanks so much for giving me this opportunity. And when I want to contribute to this motion, Madam Speaker, directly in front of you and on my left, I see a very noble writing saying, this house is for the welfare of society and the just government of the people. Our elderly are part of our society, right from the family level, community level, up to national level. I'm very happy that this bill is trying to address very seriously the issue of the welfare of our aged. Madam Speaker, a society that cannot take care of their aged, I would say it's a sick society. It is an unjust society. It is non-caring society. I know this house is not for that. And based on what I've just said, I automatically support this motion. If a council is created that will be taking care or looking after the care of our aged, we will have established a system that can even make longer the lives of these aged people we are talking about. Knowing that Kenya cares for them is medicinal. It cures them, it strengthens their lives, it gives them good health, it increases their lives. That's why the creation of this council will be a very important step. And then this society will also be taking care of this age through possibly the family as the beginning. Because the family knows this particular aged person we are talking about more than any other person. We need to know more, or the council needs to know more of what's happening with this particular aged person through the member or through members of the family of that aged person. And then we progress to the community as a whole, so that the community can also be encouraged by law to ensure that the aged in their community do enjoy the remaining part of their lives. We can then progress until we reach the nation where the council is. And when we talk of taking care of the aged, Madam Speaker, we are not just talking of financial provision to the aged. We will be looking at the shelter of the aged. We know some of these aged do not even have shelter. they don't have houses. The nation can ensure that this essential requirement in life, that is the housing, is provided to the aged person. In this shelter or the house, if this person has it, the aged has it, we can progress to find out whether he can eat in that house. It is important. And the person who knows this best are people who are within the family of that aged person. Whether nuclear family or extended, they have better knowledge of knowing whether this person is going with no food at all in his house. Madam Speaker, we can then proceed on and see whether this person really enjoys his life without people coming to molest him or harm him in any way. That again can only be done starting with a grassroots areas like I've said. I feel this bill is good. It is going to help us address the needs of those in the age bracket we are talking about. It is time for us to support a bill like this and ensure this bill succeeds so that we can be able to pride ourselves when we watch our aged and see them healthy, happy, and doing well. Once a situation like that is on in our society, then we can be able to justify what I started with, that is written on my left and in your front, that this House, and therefore Kenya as a whole, is for the welfare of our society and the just government of our people. Madam Speaker, I rest my case.
Thank you. The Honorable Dorothy Ikiara, nominated member.
Thank you, Madam Speaker. Madam Speaker, I wish to support this very important bill, that is the bill of the National Assembly, number 50 of 2022. And I wish to thank Honorable Gathoni Wamushomba, MP, Githunguri constituency, for coming up with this very, very important bill. Honorable Speaker, it's important for all of us to appreciate that old age is a blessing. Further to that, Honorable Speaker, every person who is born will one day grow old. And as we look at this bill, Honorable Speaker, it's important to think that we are not talking of people who are far away from us. We are also ending towards that age to be called elderly. Honorable Speaker, personally, I have no problem with the title, geriatric bill title, because this means it's a special area of medicine that focuses strictly on providing care for the unique health needs of older adults. It is good for all of us to appreciate, Honorable Speaker, that as we grow old age comes with its own unique challenges. And it is one thing to appreciate because, Honorable Speaker, if you grow old without health issues, then you must be very lucky. But in one way or the other, you need a lot of attention. Honorable Speaker, as I go deeper into this particular bill, I want to appreciate the government of Kenya, Kenya Kwanza government, because it is the responsibility of every responsible government to think of each and every citizen. And I want to appreciate the Kenya Kwanza government has put in measures already to start looking into the matters of elderly people. The government has initiated the health care workers, and the work of these health care workers is to go around the villages, and I'm sure the target of the health care workers is to actually attend to the elderly, because the young people can walk to the nearest health centers. Number two, I want to appreciate the government because Kenya Kwanza government has come out openly to increase the national NSSF, National Social Security Fund. Remember, for a long time, people used to contribute mega cents in form of old age or their retirement benefit. But today, the government has initiated the National Social Security Fund, which will ensure that every person who is retiring will be able to go home with something which is reasonable and something that can take care of their welfare. Honorable Speaker, but I am also equally disappointed because when we talk of the elderly people, especially people who have worked for this government responsibly, faithfully, and reaching the time of retirement, like the doctors, like other workers in the country, teachers, after retirement, Honorable Speaker, these people are languishing in upbeat poverty because their pensions never come on time. They keep on tamarking, waiting for them. Once they are out of the payroll, they don't know who to turn to. Honorable Speaker, I want to urge that this government should start hyping their game and taking care and appreciating people who have worked for the government tirelessly by rewarding them in a very timely manner. Having